Good afternoon. I'm joined today by Premier King for my update, as I'll be sharing new recommendations regarding schools and non-essential government services. And the Premier will help address any questions after I provide my update. The COVID-19 pandemic continues to change and evolve across the world, across Canada, and also here in Prince Edward Island. And really just think of what has happened here in Prince Edward Island over the last 1 to 2 weeks. Across Canada, there have been over 4,000 cases of COVID-19, and as of last night, 39 deaths. Approximately 30% of cases are over age 60. 78% of cases present with cough, and about 50% present with chills or fever. 2% of our cases in the country have ended up in our intensive care units in the country. In PEI, we have 9 positive cases and 1 is considered recovered. We've done a total of 622 tests before the clinic started this morning, and a total of 444 confirmed tests have been negative. This is a pandemic. We will see more cases and more hospitalizations. This is not over. Self-isolation and social and physical distancing is what we need to continue to do. It will help us. It will help our families and this province. And these measures do not just apply to some islanders, they apply to all of us. Today I'm recommending to government that schools stay closed until, at a minimum, May 11th for in-person learning. And this will be reevaluated as we get closer to that date. I'm also recommending that non-essential government services and non-essential businesses remain closed indefinitely as we continue to reevaluate the situation. Of course, this means that staff should continue working from home wherever possible, and only essential workers be on site. We continue to see too many people leaving and arriving to PEI for personal reasons. I'd like to remind Islanders that anyone who is traveling across the Confederation Bridge should only be doing so out of necessity. So, to say this another way, I want to be clear, all unnecessary travel into Prince Edward Island is prohibited. Now, of course, Islanders can leave and come back for out-of-province medical appointments. Healthy workers in the trade and transportation sector who are essential for the movement of goods and people across the border, such as truck drivers. Healthy healthcare workers and other essential workers commuting for work. And of course, on compassionate grounds. We've had a number of questions asking about cottagers and visitors arriving in our province. And my message to cottagers and visitors who are arriving to Prince Edward Island, you need to make sure there are people here in PEI to support your arrival while you are in self-isolation for 14 days. And if not, you should stay home until you're able to do so. I continue to emphasize that everyone coming in will need to self-isolate for those 14 days. I'd like to also mention that the National Emergency Strategic Stockpile, or NESS Clinic, is set up and is near completion. The setup is near completion and will be available Saturday in Charlottetown. It will have both a drive-through COVID-19 testing clinic, which will continue by appointment for those screened through 811. But the site will also offer a cough and fever clinic for Islanders by appointment, which will run 7 days a week. A second cough and fever clinic will be available by early next week in Summerside. And more information on how to access appointments for the cough and fever clinic will be available later today. We have heard that there's been a phishing email claiming to be providing COVID-19 results. So a reminder that individuals who have been tested will be followed up by telephone only from public health nursing or the Chief Public Health Office. We all want to get back to our normal, but this is the time we need to continue our public health measures and prepare our healthcare system for the weeks ahead. Let's do all we can to protect each other and especially our vulnerable population. I will provide some of my update in French and then the Premier and I will take questions related to the update. Le Premier ministre King est avec moi aujourd'hui pour prendre vos questions avec moi après ma mise à jour. Aujourd'hui, je vous ferai un suivi sur les services essentiels et les écoles. L'épidémie de Covid-19 continue à changer à travers notre province, notre pays et autour du monde. Il y a actuellement plus de 4000 cas positifs au Canada et 39 décès. Ici, à l'île du Prince-Édouard, il y a 9 cas confirmés. On a 444 cas négatifs et les 9 cas qui sont positifs. Et le premier cas est rétabli. Comme je vous ai dit, je m'attends à voir une augmentation de cas et de gens aux hôpitaux. On n'est pas au bout de nos peines, donc il est important que nous suivions les consignes de l'auto-isolement et la distance sociale. Aujourd'hui, je recommande que les écoles demeurent fermées au moins jusqu'à 11 mai. On évaluera de nouveau la situation plus proche de cette date. Je recommande aussi que les services non essentiels de la fonction publique et les entreprises non essentielles demeurent fermées pour une période indéterminée. Nous continuerons à surveiller la situation de l'épidémie. Ça veut dire que vous devriez continuer de travailler de la maison lorsque c'est possible. Et seulement les travailleurs essentiels devraient se présenter à leur lieu de travail. Un rappel à tout le monde qui prend le pont de la Confédération, ça devrait être pour des voyages essentiels. Ne prenez plus de voyages non essentiels. Nous voyons qu'il y a de plus en plus d'attaques et nous voyons qu'il y a des courriels d'hameçonnage avec des résultats de tests. Vous recevrez juste les résultats de mon bureau par téléphone ou par les infirmières de santé publique. Je sais, et je dis ça chaque jour, que ce n'est pas facile. On veut retourner à la norme, mais ce qu'on doit faire maintenant, c'est de se protéger les uns les autres. Je vous dis ça tous les jours et je vais répéter ça dans les jours qui suivent. Mais c'est tellement important pour protéger nous, les familles et les gens vulnérables. Je suis maintenant prête à prendre vos questions avec le Premier ministre. We'll open it up for questions.
Jim Day, The Guardian. Jim Day, The Guardian. Okay, we'll go to Sean McDougall, Eastern Graphic.
Mr. Morrison, you've reiterated today and in other press conferences that the situation is going to get worse. On the 23rd, earlier this week, the Western Hospital, though, had to close its emergency department due to a lack of nurse coverage, and there's no reopen date announced either. So that brings up the question, do we have enough nursing staff for when this situation gets worse?
So we are talking about, when we talk about preparing the system, we talk about making sure there are enough supplies, but it's also about talking about our human resources. And I know health PIs going through all sorts of HR plans. You've heard Marion Dowling speak about reaching out to recently retired nurses and physicians and other staff for just that reason, so that as the cases increase in the weeks ahead, we will need our healthcare workers, and we thank them for that the work that they're doing. So it is something I know Health PI is actively working on, and is an important part of the preparedness plan for the system.
Okay, thank you.
You're welcome.
Sean, do you have a follow-up? No. Okay, we'll go to Nicole Williams, CDC.
Hi there. Yes, this question would be for Premier King. Just looking to get a clearer picture of what will happen now with students now that schools will be closed for quite a bit longer. Are there online classes ready to go? Is there a curriculum ready to go? And if so, when?
Yeah, that's a good question, and a lot of people have been asking that question. I think since the original decision to close schools for 2 weeks, there have been a great undertaking on behalf of the public schools branch, the Department of Education and Lifelong Learning, teachers, but also with other jurisdictions to try to figure out what is the best way to do this. Minister Trivers will be prepared Monday to roll out what the next first steps look like here for PEI. I believe it will include a lot of online learning, some home-based learning, some individualized learning. Recognizing, of course, that whatever we offer here, we know won't be perfect, but trying to make the best out of a difficult situation to ensure there's as much learning as possible during this time of uncertainty.
Thank you. And my next question is for Dr. Heather Morrison. I know that we're still not seeing the flight info for these positive cases that we learned about yesterday and the day before. Just wondering what is sort of the rollout plan for that information, especially since New Brunswick made one of the flight infos public yesterday.
I'll be honest, I actually thought I know the intention is to have it up there, and it was submitted, so it's just, I think there's so many things being submitted to try to get up on the website, but it should be there today for sure, and it was discussed at our meeting this morning, and the information is available, and it's just should be shortly. That if it's not there already, it should be there shortly. And I'm sorry it's not there already.
Are daycares lumped in with schools? Just want to confirm that they're closed too for the extended period of time.
I'm sorry, I just missed your question.
Oh, I just want to confirm that daycares are also closed till the same date that schools are closed until.
Yes. They will be, and I think in terms of the daycares, I think there'll be further discussion from early childhood learning about daycares for essential workers, and that will come, and Premier, you may want to speak to that as well.
Yeah, I think we will continue with the directive that Dr. Morrison has given with those individuals, daycares and early learning centers, with an extra emphasis, of course, on trying to make sure that that service is there for our essential services, including our health workers, and that has been our intention all along, and so that will not change with the new directive given here today.
Thank you.
Carrie Wynn, Ocean 100.
Hi, Mr. Premier. I'm just wondering, you spoke about the daycare for essential service workers. We've had some contact with some wondering about updates. Apparently, they've filling out the forms and stuff for essential workers last week, but they haven't heard anything, and facilities are struggling for staff on a good day, particularly the healthcare facilities. And now folks are missing days because of childcare. Can you give us an update? Is that all up and running the daycare for those essential workers? And are there enough there to meet the demand?
Yeah, so just to sort of to revisit it, Carrie Wynn, essentially what we've been trying to do with the Early Childhood Association and others is to identify some individuals who are prepared to come in and offer that service for those who need it the most. It has been a delicate dance, to say the least. The last update that I had as of yesterday, it was moving along, not without some challenges, of course, but the intention is to try to make sure every available healthcare worker that we need on the front lines now is available to do that job on a daily basis. But once again, I think that's something that Minister Trivers will be able to update as the day rolls on or into tomorrow. But it is our intention to make sure that we have every available healthcare worker on the front lines.
And Dr. Morrison, I'm just wondering about maybe some infection control protocols that you could recommend for some tradesmen, who have to go into private homes mostly. I know they're probably screened beforehand, but apparently, there have been some evidence where folks have, maybe fudged the truth just a little bit. And, like cable technicians, carpenters, electricians that have to work in private homes, and what their companies should do to protect those tradesmen. Do you have any recommendations for that?
Hi, Carrie Wynn. So, I think our advice certainly is for everyone to try to maintain that social distance. So if someone is in the home, of course, maintaining social distance for the family as well as the person who may be going in to do a repair, and it would be an essential repair. Of course, making sure there's good hand washing as soon as someone enters, and making sure that that's available, either hand washing with warm water and soap or alcohol-based sanitizer, and before and after they leave. And that's important to protect the staff, protect the person who's going into the house, but also protect the people in the home. And we're trying to give some of that advice because mostly it's general advice, but important advice to businesses, and some of them have reached out to us independently, and we've tried to provide what we can. Certainly, if there was someone in that is a COVID-19 case, then that would not be the time to have someone go into the house for that, and that would be delayed.
Thank you, Doctor. Thank you, Premier.
Thank you. Julien Lecacheur, Radio-Canada.
Question to the Premier. Premier, we spoke together a couple of days ago about the situation with the Magdalene's Island. You discussed with the Premier, François Legault, about the situation. They decided to shut down this link between Surrey and the Magdalenes for the residents. So the trucks will be able to continue to use the boat. I would like to know, why did you decide to take this decision for the residents of the Magdalene Island? And I would like to know if it is your decision or if it is the asking from François Legault.
Sure. Well, merci. Thank you for the question. The conversations I've been having with Premier Legault and our staff, with his staff, the decision came forward from the Premier of Quebec to suspend service other than the essential service. Essentially what we are doing, or Dr. Morrison is doing here in Prince Edward Island. We want to make sure that essential link continues. If people need to get off of the Magdalene Islands for emergency health services, etc., that a possibility is there. I think really it just came down at the end that the Premier of Quebec, like the Premier of Prince Edward Island, wants to be doing everything we possibly can to keep people at home and to make sure this spread of COVID is contained and mitigated to the extent that we can. It wasn't a pressure that I put on him at all. I really just wanted to make sure we had a consistent level along the way. recognizing that people who are trying to get back to the Magdalene Islands need to do so through Prince Edward Island. And it was a good, thorough discussion, and I certainly thank the Premier for his consideration.
Just a follow-up on this. So I think the last boat for the residents of the Magdalene will be on Saturday at 2 p.m. in Surrey. What will happen if people from the Magdalene continue to cross the bridge and to try to go to Surrey? Do you will stop them at the bridge and do you will ask them to go back to New Brunswick, or do you will let them go use the boat?
I think the Premier's office and the Transportation Department from the province of Quebec have been reaching out to those citizens to tell them that no longer is the route they should take. They've been offering assistance for flights and other ways to get those individuals home. I think we will just probably have to deal with that on a case-by-case basis. But as I understand, the Premier and the province of Quebec have reached out and continue to reach out to those citizens trying to get home and are telling them to take a different route.
Thank you.
Merci. Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'avais tout d'abord une question de clarification. Vous avez dit en anglais que les voyages à travers le pont de la Confédération seraient désormais interdits s'ils ne sont pas essentiels. Est-ce qu'ils sont interdits avec des contrôles ou est-ce que vous dites je ne le recommande pas tout simplement?
Ça va être, si c'est pas essentiel, pour les raisons que j'ai déjà listées, ça va être interdit.
D'accord. Est-ce que vous pouvez expliquer en français également ce que vous avez dit sur la clinique qui va être mise en place samedi à Charlottetown, s'il vous plaît?
Je vais essayer, c'est Laurent. Alors, la clinique va commencer demain ici à Charlottetown et puis une autre clinique la semaine prochaine à Summerside. C'est presque prêt à fonctionner. Ça va être, va avoir un parti qui est un drive-through qui est organisé pour le tester avec 811, mais il y aura aussi une clinique qui s'appelle comme Tous et Fièvres clinique et ça va être aussi par organisé, vous pouvez pas juste aller, ça va avoir un appointment et ça va être les détails sur plus de détails cet après-midi.
Merci.
Merci.
Merci. François-Pierre Dufault, Radio-Canada.
Bonjour, Dr Morrison. Pouvez-vous m'expliquer en français tout ce qui est intervenu dans votre décision de recommander de fermer les écoles au moins jusqu'au 11 mai? Qu'est-ce que vous avez pris en compte pour prendre cette décision de faire cette recommandation-là?
Pour faire cette décision, on regarde qu'est-ce qui arrive partout au monde, qu'est-ce qu'on sait du virus Covid-19, le montant de temps qu'il y a des personnes tellement malades dans d'autres pays, qu'est-ce qui arrive ici au Canada. Et on voit le nombre de cas qui vraiment double chaque 3 à 5 jours. J'ai une équipe d'épidémiologistes qui m'aident à faire des décisions comme ça. Et puis, comme j'ai dit, on dit le 11 mai, mais ça va être déterminé parce que ça change. Ça peut changer et on continue de faire des décisions et regarder l'évidence qu'on voit partout au monde et aussi au Canada.
Follow-up question for Premier King, if I may. The distance education, so online education for students of the schools that will be closed until May 11th, is there anything that is in place or will be in place for the kids that are in more remote locations on the island where internet service is not optimal to make sure that they have access to the same opportunities of learning than other kids that live in Charlottetown or Summerside where the access is better?
Sure. Thank you for the question. It is a very important question, and it's one that we are struggling with here in Prince Edward Island, but so are our counterparts in the rest of maritime Canada. So what we're really trying to figure out is what is the most efficient and productive way to roll out some type of home-based distance learning, recognizing that there are significant challenges with that depending on where you live. So through the public schools branches, both English and French, through our professionals at Education and Lifelong Learning, and with the assistance of teachers, we're really trying to cover all aspects of that. We're trying to, as much as we can, individualize some of the learning plans as well, and keeping in mind with all of those things. But to be very, very honest, we don't have that part figured out yet. It continues to be a really, really big challenge. And I think on Monday, Minister Trivers will roll out some more of these details, and it will be things that we haven't done before. And as I keep saying, it seems like every day we're on here, we are doing things that we haven't done before, knowing that it won't be perfect, but trying to get it started at least, and then identify some of the gaps as they present themselves.
Thank you, Premier.
Thank you. Rose Saint-Pierre, Radio-Canada.
Oui, bonjour, Madame Morrison. Ma question concerne les informations que vous donnez concernant les personnes qui sont infectées. Il y a beaucoup de provinces qui refusent de donner le numéro de vol d'une personne qui a voyagé, qui était infectée. On le fait à l'île du Prince-Édouard. Pourquoi?
Mais je sais qu'il y en a d'autres provinces qui en fait, et puis la direction est que on pense aussi qu'ils vont en faire au niveau fédéral aussi, mais maintenant c'est peut-être moins d'importance parce que les personnes qui arrivent au Canada doivent s'auto-isoler, n'importe quoi. Et même presque partout, il y a aussi que vous arrivez d'une autre province et vous devez s'auto-isoler aussi. Alors, en premier, c'était plus important peut-être d'avoir les vols tout de suite parce qu'on donnait une direction différente, mais c'est une pratique qu'on a commencé et on va continuer d'en faire.
Est-ce que vous avez des inquiétudes par rapport à la confidentialité?
Mais je suis chaque jour, j'en y pense. On suit en grand principe qu'est-ce que les autres provinces ont commencé à faire quand ils ont annoncé leur premier cas. Et puis, on ne donne pas un âge, pour exemple, spécifique, on donne une range de date et range d'âge. Et il y a d'autres provinces qui nomment même les villes d'où les cas habitent, mais pour nous, c'est des régions de l'île. Et je pense que je vais continuer à faire ça parce que ça, au plus que possible, c'est confidentiel. Il y a beaucoup de gens qui voyagent, mais c'est tellement important qu'ils s'ils sur un vol avec des autres qui s'auto-isolent. Mais maintenant, c'est pour toutes les personnes.
Merci.
Merci tout le monde.
OK. Thank you. Merci beaucoup.